Alrighty, hi everyone, this is Alena from Furley Bioextracts again. This actually next month, starting Thursday, will be April, which is Irritable Bowel Syndrome Awareness Month. You may have heard of IBS before, and we are going to talk about that in a little more detail today. So, what is IBS? Well, IBS the full name is Irritable Bowel Syndrome, and what that is it's a long-term gastrointestinal disorder characterized by an abdominal pain, as well as diarrhea and constipation. Sometimes one or the other, or even sometimes an alternation. It really depends on each person. So it usually involves the colon or the small intestine, and it's really an impairment of the gut and its motility, so its ability to actually push your waste through the gastrointestinal system. Okay, so these movements are actually regulated by the brain, and that's why gastrointestinal disease is not just a tummy bug. It's actually also classified as a brain gut disease, or a brain gut disorder. Sorry, there's a difference. There's a brain gut disorder because the part of your brain that controls the movement in your intestines might not be working efficiently. And it is very prevalent worldwide. It affects 10 to 15% of adults. However, few actually seek medical help because a lot of people can just write it off as stomach trouble or a tummy bug, as I mentioned. But it's more than that, right? So it is non-life threatening. However, the symptoms can range from mild to severe, and if it does get severe, it can be quite debilitating because the pain can be quite intense, and because of this pain and intense discomfort, it does lead to people having to take the day off from work or not being able to do something they wanted to do that day due to being able to bear with the pain or the discomfort because it's so intense. And also it's treated through it increases the number of your outpatient visits because it's a non-life-threatening disease, but you still need to see the doctor. And the only way you can get an accurate diagnosis is if you see the doctor. It's not something that you can diagnose yourself at home. Not that you can diagnose anything yourself at home. It's always best to seek professional medical attention or professional medical help in the case of actually diagnosing anything you think you might have. All right. And IBS is actually the second most common reason for people missing birth after the common cold. And the treatment, there are many treatments available, but they vary from symptom to symptom, vary from patient to patient depending on their symptoms. So, as I mentioned, common symptoms are abdominal pain, bloating or gassiness, and changes in bowel habits. So, as I mentioned, constipation or diarrhea, and the changes can be quite sudden, and they may alternate or they might just be one or the other, but there is a significant change. So, moving on to our GI system, we know that our gastrointestinal system or our digestive system is made up from the top, comes from the mouth to the esophagus, down to the stomach, to the small intestine, large intestine, and finally your anus, where everything comes out. And within the middle section, where you have the stomach, the small intestines, the large intestines, there is something that I think many people are aware of, gut bacteria. You have your own microbiota, your own ecosystem in your body. And if you have a well-balanced ecosystem or bacterial ecosystem there, you shouldn't have any issues. However, there have been studies to show that the balance of microbiota in our gut can affect people with IBS, and it can also affect the severity of their symptoms. So coming back to the microbiota, the functions are that it helps protect us against pathogens. It helps our gut develop its immune system, and it also produces a variety of substances that have important nutritional value. So all those vitamins and minerals, like, they all get processed in the gut. And as I mentioned, the gut microbiota, there may be evidence that it is a factor for IBS. And some people may also develop IBS after having a stomach or intestinal infection. It's also called post-infectious IBS. And also it can also be caused by small intestinal bacterial overgrowth as well. And one of the treatments is thought that by altering the gut bacteria, it can also lessen the symptoms of IBS. Other studies have shown that IBS does present with low-level inflammation, and it's much less seen in true bowel diseases such as ulcerative colitis and Crohn's disease. Those are two really serious gut diseases. But as I've gone through all the possible causes, I think you can guess that the actual cause of IBS is still pretty unclear. All right, and moving on. Yep, and probiotics are thought to help at least with the gas-related symptoms, because probiotics, especially Bifidobacterium infantis 35624, has been shown to relieve the main symptoms of IBS, so abdominal pain, gassiness, and changes in your bowel movement. If you do go to a doctor and they do and you want to be treated and you want to be diagnosed by your doctor, your doctor should already know your full medical history in order to treat you effectively, recognize the significance of your symptoms, empathize with the discomfort you feel and how it affects your life, and be prepared to spend as much time as necessary explaining what is going on inside your body, and actually be able to educate you and work a long time with you for your IBS needs, because it's usually a long-term disease. So basically, if your doctor is not making you feel comfortable or heard about your disorder, or if they are denying what you're saying without having any, you don't feel comfortable about the way they're doing it, always seek a second opinion. That is your right to do so. All right. So what happens if you are diagnosed with IBS? First thing you'd want to do is to educate yourself as much as possible about the disorder. I mean, we have the internet these days, so it's actually quite easy to find resources about IBS. You could go onto Facebook and find an IBS support group, seeing as worldwide this disorder does affect 10 to 15% of the population. So you're definitely not alone in a disorder you may feel a bit uncomfortable about, or you may feel is embarrassing because it's to do with gassiness and our gut system. So you're not alone, that's for sure. So other things you can do after you have been diagnosed is you should also keep a diary of your symptoms. And also another thing is to actually keep a food diary, because IBS symptoms can be triggered or become more severe depending on what food you eat. So there have been some suggestions that foods like wheat or gluten and dairy can aggravate the symptoms of IBS. So definitely consider cutting those out from your diet for at least 2 to 3 weeks, and then seeing whether or not there's an improvement in your symptoms. And if there is no improvement, then move on to the elimination diet, where you would basically eliminate everything and start eating just one food at a time for a week or two, observing how you feel, and then slowly reintroducing other foods one at a time, and also taking note of how you feel, whether or not your symptoms get worse or not. And obviously, as I mentioned, IBS is different from person to person. So not all people respond well to conventional medicine or to Western medicine. And some people may feel that the side effects of medicines prescribed for their condition, they may experience side effects which they are unable to stomach. So yes, there are definitely complementary and alternative treatments. The main one would be traditional Chinese medicine, and it is an example of a compound treatment because Chinese traditional medicine has its own set formula based on that individual patient's symptoms, and no one formula is the same as the other. It's a combination of herbs, usually at least 5. Obviously, if you are taking other medications, or if it's for your child that's suffering from IBS, or if you're pregnant or you're lactating, always seek help from a medical professional before going down the avenue of alternative medicines, because some herbs do have interactions with medicine you may be taking. Let's say, for example, you take heart medicine. You want to know and make sure whether or not a herb prescribed by a traditional Chinese doctor will interact with a herb, will interact with the medicine you're currently taking. So that's always really important. Okay, and So herbal treatments. Oh, okay. So some herbs that may be included are rhubarb, barley, tangerine peel, cardamom, and licorice. They're good for your stomach. They've been used for thousands of years in traditional Chinese medicine, but in terms of Western medical research, not much has been done. Other herbs that are helpful are peppermint oil and ginger. Now, these two are so-called home remedies that have been commonly used for many years, and I think many of us know about the benefits, especially when you feel nauseous or you feel like you want to throw up. Peppermint oil and ginger can really help. So what peppermint oil is thought to decrease muscle spasms. So muscle spasms are painful. Peppermint oil is also thought to improve abdominal comfort, reduce bloating. There is, however, a side effect of heartburn, so you have to have just the right dose, and so as such it should be used with caution, and data is still unclear, so who make clear recommendations. The other one is ginger. It's thought to be anti-inflammatory and strengthen the gastric lining, as well as stimulate motility of the intestines. Another alternative treatment for IBS is acupuncture. So acupuncture works along the basic theory that our body has meridians of energy called qi, and along those meridians of qi, there are 350 points, 360 acupuncture points. My mistake. So if you are in perfect health, all of those points would be free and qi can flow freely through them. However, if you are suffering from any kind of illness, those qi points are blocked, and what acupuncture needles do, they release the energy and they release the obstruction in that point, allowing the qi to actually flow freely again. Sometimes, if you've ever done acupuncture, you notice they do hook it up to a machine and give you a bit of an electrical pulse to increase the effectiveness of the treatment. However, as with a lot of traditional medicine, there are insufficient clinical results, but many of us, I think, especially as an Asian community, we still do acupuncture, especially for symptoms of abdominal pain, bloating, and nausea. It's generally a safe treatment so long as it's done by a licensed practitioner, and it may be good as an adjunct for patients sensitive to oral medicine. So basically, if you're sensitive to medication taken orally, you can try acupuncture, and it may be used along with herbal therapy. Next alternative treatment is the alteration of intestinal flora. I did mention this earlier. This is done through the ingestion of antibiotics or probiotics. this is something that your doctor would need to, this is definitely a treatment that you would need to discuss with your doctor, because altering your microbiota in a safe way, it's not the safest in my opinion, because it's really easy just to kill all the bacteria, it's really easy to mess with the bacterial balance in your gut and maybe even make things worse. As I mentioned, ingestion of probiotics, so fermented foods like sauerkraut, kimchi, or yogurt, which contain a lot of lactobacillus and bifidobacterium, can help relieve the gut symptoms of IBS. Another interesting one is hypnotherapy. This one, I think you may understand from the word. So hypnotherapy, basically, it's the hypnosis of the patient. It has been shown to be effective in several clinical trials, and this particular treatment does take a long time. You would need to go for several treatments over the course of a few months. And basically what they do is they would first progressively relax you, and then once you are relaxed and so-called under hypnosis, they would suggest soothing imagery and sensations centering on your symptoms. Improvements that were seen in these clinical trials were overall well-being, quality of life, improvement in abdominal pain, so reduction in constipation, and improvement in bloating, so reduction in bloating. But the caveat with hypnotherapy is that it's difficult to find a therapist who can do both hypnotherapy as well as have a functional knowledge of gastrointestinal disorders. So it's definitely an interesting alternative treatment. It just takes a lot of work to find the right therapist for you. So finally, last part, self-care with IBS. What can you do yourself to reduce the symptoms safely, or to control the symptoms safely, is to ideally sit when you're eating, best at a table. Try to relax before meal times, and don't drink too much water while you're drinking. Just sip a bit, and maybe drink 30 minutes beforehand or 2 hours after your meal. So yeah, I hope you learned something today about IBS. If you think you may have it, definitely see a doctor and see what they say. If it's something that really affects your life, it prevents you from working or enjoying life, it's definitely something you should take action about and see your doctor. So happy IBS Awareness Month in April, and I will see you next week. Bye.